business news, Connecticut's most watched local political program. This is Face the State.
Good morning, everyone. I'm Dennis House. Thanks for joining us for Face the State. First off, this Sunday, Connecticut is getting high marks in the battle against coronavirus. Social distancing and the quarantine appear to be paying off. Joining us now, the president and CEO of Hartford HealthCare, Jeff Flaks. And Jeff, good to see you back here again.
Good morning, Dennis.
So, Jeff, why are we doing well?
Dennis, I think the actions that were taken, relative to social distancing, closing non-essential services, broad testing, measured approach to kind of bring things back together, all of the policies, all of those decisions, the accumulation of that has really shown that they work, and they've allowed us to contain this to the extent we've been able to.
As you look at the hospital, do you feel the change that's going on right now in terms of the reduction in hospitalizations and the number of cases going down?
Unquestionably. Dennis, we're down today to 20 inpatients today across our 7 hospital campuses who are COVID-19 positive. We were north of 500 at our peak. So we've seen it come down considerably. In the testing we're doing now across every community, across the whole state, the prevalence is around 1% or so. So we're absolutely seeing data that is showing that the containment strategy is working.
So a month ago, we heard people in Texas and Florida rejoicing that their state was reopening, and now these two states are really seeing a huge uptick in the number of cases of coronavirus. What are they doing wrong there?
The timing of when you implement these practices, the rigor in which you implement them and oversee them, absolutely critical. So for the states who've been very relaxed or late to implement these practices, there's a clear correlation to the exposure that's occurring within their communities. So I think when we look at Connecticut, and I really applaud the work by the government, all the health systems coming together, it's why we've seen containment, and it's why largely in the Northeast right now we're seeing the numbers fall really universally.
As you know, the governor has called on people who come from these states where we are seeing an uptick in coronavirus cases to quarantine for 14 days, should they come to Connecticut. In terms of, let's say, a Texan is coming to Connecticut for the summer, how dangerous is that to everyday people here?
Look, I think it's an appropriate precaution for us to take as a state. I think we have to ensure that we have testing in place and that we know, to the extent we're able to, where we have hot spots, where people may have had much higher levels of exposure, that we're ensuring that we're making testing available to these people and helping them quarantine safely. So they can get on the other side of what would be their incubation period. So to me, it's about doing it in a thoughtful, respectful manner, but I think there are ways to ensure that we have good precaution and containment strategies.
The nation's top infectious disease expert, Dr. Anthony Fauci, said this week that it's not a question of if, but when we will have a COVID-19 vaccine. He says perhaps by the end of the year or in early 2021. What are doctors at Hartford HealthCare talking about in terms of what this vaccine will be like and whether people want to take it?
Well, our physicians are involved, and we're doing research. We're participating in these studies. We're working with the federal and state government very closely. But let me say this. The vaccine is essential. And absent the vaccine, what we're doing within our health system is we're preparing. And we need to prepare for the risk in the fall and into the winter for the potential of a second wave. And our organization needs to take all the lessons we've learned in this process and ensure we're even better prepared for what could happen within our community between now and the time that vaccine ultimately is able to be mass produced and well distributed.
Jeff, there are some people who say, I don't know that I would take a vaccine right away. I think I'd give it a year or two to see the impact on society. If the vaccine does come out, let's say in December, would you be at the top of the line to get it? Would you get the vaccine?
I would. I think we're going to see, first of all, with the FDA, we have very rigorous processes in place. So I think there's going to be very careful attention for this, and I think that we should have confidence in the teams of people who are working to create this vaccine. And by the time it gets to the point that it'll be distributed to people within our communities, it's going to be well tested and ultimately, I think, well proven.
What did going through this COVID-19 experience teach you about the Hartford HealthCare system in terms of the way that we treat people? Is there any lessons that we're taking out of this?
Enormous number of lessons. First of all, confirmed what I knew. We have incredible people who work here. They do amazing work, true healthcare heroes, and this just amplified kind of greater visibility into seeing the heroic work people do in healthcare every day. But we learned so many lessons. Dennis, I've said this many times. I don't want us to go back to normal. We will be better than normal. We'll be better than normal. We'll be more accessible. We're going to have higher quality, closer engagement with the people we care for, and we're going to see these innovations like telehealth and so forth really transform where and how healthcare is delivered, and it's going to make it more cost-effective at the same time. So I'm really confident that there will be invaluable lessons that come from this, and we are putting them in place.
Once we see the vaccine come on board, do you believe that we'll see an end to daily wearing of masks in stores and plexiglass dividers in restaurants?
I hope so. I hope so. And at the same time, lessons like around hand hygiene and some of the many lessons we learned around how to manage the risk of infectious disease, I think things like handshakes and so forth, there's going to be some long-term considerations for changes in practices within our society. But the notion of kind of wearing masks and having plexiglass in place in different settings and so forth, I certainly yearn for when we will be able to have those greater, closer human connections.
There tends to be some fear about a second spike in the fall. Is the state prepared for that?
We are preparing. It's an opportunity right now while things have significantly become more manageable over the last number of weeks, but we're 100 days plus into this pandemic. It's not over. We are not letting our guard down, and in fact, the opposite. We're using this period of time to strengthen our preparation, build bigger inventories of PPE, have more ventilators in place, more planning in place around how to redeploy staff and stand up auxiliary hospitals. So we absolutely, working with the state, will be even more prepared.
Jeff Flaks from Hartford HealthCare. We always enjoy having you in the program. Enjoy what's beginning of your summer, I hope. I hope you get some time off. Thank you, sir.
Thank you so much.